Hi guys, Dr. Anjana Bhana here and welcome back to my channel. And I'm super pleased to welcome back Dr. Nikita Morar. So thank you for coming back. So that means we did something right. and we've tucked it in snugly. It's very cold in Joburg today. It's not usually this cold, but I think it's the tail end of winter. And today Nikita is going to have a superficial chemical peel with some lacquer, hydrogen. I don't think lacquer is like a medical term, but hydrating hydrogel mask, some LED light to reduce inflammation. Because tomorrow you have a photo shoot, right? Yeah. So it's actually a nice safe treatment to do before an event. I wouldn't do anything deeper than that, but we are also doing your lips. So I'm going to be gentle when we do the lips, but lips do tend to swell. Sometimes it can bruise, but you will be wearing makeup on. You will be wearing some makeup. So it's safe to wear makeup the next day, and I'm super excited to get started. So the relaxing part comes first. So when we're doing these procedures, if you want to do multiple procedures or combination procedures, and if you're doing injectable treatments, just check what you can. You have to know what you can do in what order and if you can do them together. So today we're doing the peel first, so nothing gets into the lip, no peel, because I'm going to be poking, so there'll be needle pokes, and we don't want any peel substance to get in there and disturb the skin, and we have to keep the area clean and disinfected. So
you're just applying a bit of pressure on your lips. There you go. So starting with the foam of 15, it's got a bit of glycolic in it. Might tingle a bit. So this peel stays on for a maximum of 3 minutes. However, if you feel you'd like me to neutralize sooner, you can just let me know. This peel includes a bit of salicylic acid in here as well, which helps just with breakouts if you do have any. There is some lactic acid and glycolic, which will help for the hydration as well. Is it tingling in any specific area?
It's just like the cheeks mostly. Yeah. But that helps.
So we neutralize it with water, so I'm going to give it a few wipe downs. If you I'm going to find out from you if there's any tingling anywhere, just let me know. I'm going to split some GF on. Can you take a deep breath in, and when I breathe out, I'm going to split. Inhale and out.
So Nikita, now we're going to do something called a hydrogen mask. You're not claustrophobic, right?
No.
Okay, so is it okay if it goes over your eye and your lip as well? So it's really nice and hydrating. So there's so many different kinds. So we're going to put a couple of different ones on. So over your eye, something called illuminating orange. It's got glutathione and niacinamide, so it brightens the under eye area. We're going to put something called that radiance biotin over your lips, and then Sheila will do the rest of your face with like a revitalizing beta keratin. It's got calendula flowers, like calendula, that's how you say it, calendula flowers, and everything's organic, and it's got a white willow bark. So that's actually where the idea of aspirin comes from. So it's an anti-inflammatory. It really calms you down after a peel. Yeah. And keep your eyes closed, please. So this is the one with the glutathione and niacinamide, and Sheetal's got one that has beta keratin. And
so I'm going to put the LED light over here now. Are you comfortable?
I think 10.
I'm going to put the blue and green light on. It will help with healing and just with brightening the skin as well. And we'll leave it on for about 10 minutes. Just doing that. It's a peel off mask, so I'm just trying to get edges out. Peel it off, there you go.
Oh wow, this is so beautiful. I absolutely love it. My skin is glowing. Thank you.
So I'm glad you had a pre-relaxing ritual. So you're done with your peel. How did it go?
Really beautifully.
Okay.
Really nice.
So now I'm going to, but you're numb now. So I'm going to inject your lips. So we're not going to go big or go home. We're going to do it beautifully. But immediately after, you will get a bit of swelling. So you might look very big, but don't worry, it'll settle down. Yeah, and you'll just feel a bit of, I know you've had other procedures done that were a bit more intense, so you're just going to feel a little bit of a small little poke. Yeah. And that's it. So I'm going to disinfect. I'm going to spray some of that GF in your mouth as well, because Nikita is also a dentist, so she knows how germy the mouth is. So we're going to disinfect the inside and the outside. But when you think of, like, I know because we've had a discussion before, but like for your lips, what do you want for them? You know, what do you do you want it subtle? Do you want it, because we have gone subtle before? Like, what do you want out of a lip filler treatment?
So I just like a little bit of plump.
Yes.
We have gone subtle before.
Yes.
Which is nice. It doesn't like a natural look. But I do feel like my top lip is slightly more flat.
Perception drift is when you do a procedure and then after a while it feels like you've done nothing because you get so used to the perception of yourself, and then it goes on, and that's, I think, where whoever allows the person to go on, that's where you see so-called botched procedures. So there has to be an end point, and Nikita has some beautiful, I mean, your lips are beautiful shapes, so we don't want to distort your lips, just want to make them look like you say, lush, fluffy. And I'm going to use a really soft filler for you, and what happens is that it absorbs quite a bit of water, so tomorrow you might feel a bit more swollen or look a bit more swollen. Just mind that it settles down, but it won't be anything. I know you're having a photo shoot, so it won't be anything weird or distorted tomorrow. It'll just be a bit soft. Okay, I'm going to spray the inside of your mouth. There we go. Like sort of the in thing now. So you see lots of interesting lip shapes. So also here, Nikita, you've got like, and it's actually very attractive in a woman, this little dip, yeah, under the lower lip. So we're not going to do anything with that, but as people age, it gets deeper and deeper. So when we do treat the lips, especially in an older patient, sometimes I fill that, and there's no need to really go the corners of your mouth, you know, there's no dipping down. And because your lip tissue is so firm, your tissue is really good quality, so there's no need to go anywhere around the mouth.
beautiful.
I love. Yeah, and I think it looks very nice. It's
nice.
natural.
I like it.
It still looks like you. Yeah, I'm happy.
Thank you. I'm happy.
Pleasure.
Thank you so much.
Thanks for joining me today, guys. And don't forget to like, share, and subscribe. And any comments down below. Thank you.